Welcome back to episode 2 of Corner Network. This is the platform where we have open discussions and we deliberate on things that are relevant to the field of psychology. I hope you all have seen our first video. If not, we've already linked it in the description box. You can please go and access it for better context. To give you a brief, we spoke about what is the current scenario of psychology in India and how we can make it comparable to international standards for the benefit of the people in India. We even spoke a little bit about what kind of professionals there are in the field of mental health. And in this episode, we'll speak a little bit to add to that point in terms of nomenclatures, etc. Please let us be on record and say that this is only for awareness. And if there are any constructive feedback, we're very, very happy to have them. So please feel free to use the comment section to let us know of what your thoughts are on this particular topic. We would love to have that sort of an engagement with you all. Let me just quickly introduce myself. I'm Shrita. I'm a clinical psychologist. I have been in the field for the past 5+ years. I'm trauma focused and queer affirmative in practice. And we've all been working in the same organization, I think about a year or so ago. And then after that, we came up with Four Corner Network to have upskilling videos and webinars for the betterment of young psychologists. So I'm going to open the floor to the rest of my team members, Lipika, Dimple, and Debulina. And I would like to first have you all introduce yourself before we go ahead with the intention for today. Debulina, would you like to go first?
Yes. Hi, I'm Debulina. So as Shrita already said, we were colleagues once upon a time, and eventually we had opened this venture to upscale things in psychology. So I am a PhD scholar and I have done my MPhil in clinical psychology, and I also used to be an academician and currently a practicing clinical psychologist. So my interest areas lies in neurodevelopmental disorders and in emotional dysregulation. So I have been in this field from past few years, and I really look forward to be in this path with all of you and see how things go. I would like Dimple to introduce her.
Thank you, Devilna. I am Dimple Panchal. I am in this field from past 6 years. I am in teaching field as well as in practicing field. So yes, the domain where I practice is child psychology, neurodevelopmental disorders, and even I have generated recent interest in positive psychology. Even I'm interested in research work. So yes, that's about me. I'll hand over to Lipika.
Thank you, Dimple. So my name is Lipika, and I am also a RCI licensed clinical psychologist, just like rest of my teammates. I'm also a PhD scholar. I'm doing my PhD in psychology. I'm a practicing clinical psychologist. Within clinical psychology, my subspecializations lie in depression, anxiety, behavioral addictions, addiction disorders. And I am also keenly interested in research, and we have come up with this platform to sort of help new practitioners and students to equip themselves with skills, and already practicing psychologists also to upskill themselves so that they can serve people better.
Absolutely. Thank you so much, everybody. It only makes sense to talk a little bit additionally to what we left off in the first episode. Can you all give me a picture of what kind of misinformation is out there about mental health and mental health practitioners in India right now? Lipika, would you like to give us a general overview of that first?
Yeah, I think since COVID, what has happened is that there is a lot of talk about mental health, because during COVID, because of the lockdown and because of the nature of the disease, there was a lot of mental health problems that people were going through. So because of that, the stigma around mental health has reduced a little bit, and more and more mental health practitioners are coming up, and people are seeking therapy more and they are seeking help more, which is a good thing, because we're talking about mental health more. But the other downside of it is that there are so many mental health practitioners that are coming up, especially in the age of social media. Everybody is a mental health practitioner these days. Whether you open any kind of social media site, you will find somebody or the other saying that they are a mental health practitioner or they are a life coach or whatever, any of those kind of things. Now the problem is that a lot of these people are self-acclaimed people, like, they themselves claim that, okay, we are mental health practitioners, but we don't really know the credibility. And especially platforms like Instagram or Facebook or any of these platforms don't really verify what the individual actually is, because they are not educational platforms. They are entertainment platforms, and it's because a lot people are using it to maybe increase their practice or maybe increase awareness. But the problem is that since these platforms don't verify the information that you're providing, so people don't really know what is it that you're doing. So because of that, people start to believe that if there are 100 people saying that they are mental health professionals, all 100 of them are mental health professionals, whereas that may not be the case. So in India, we have certain guidelines in place that says that who can be a psychologist, who can practice, what can they practice, what populations they can see. So those regulations are in place. But because of the boon of social media, and because now everybody wants to be a mental health practitioner, everybody wants to talk about mental health, everybody has become a mental health practitioner. So the general audience doesn't really know who exactly do they want to go to, or the person they are talking about or they're talking to, are they really trained in psychology? Are they really qualified to be a psychologist? So I think Debelina can maybe talk about this a little bit more.
Yes, I do agree with you, Lipika, 100%, that there are people who are self-proclaimed mental health practitioners and the life coaching, etc., etc. Some of them, yes, they are doing wonderful job, definitely. But also there are people who, as they are claiming to do something, but the outcome is very different. So as we all know, it is open to debate and open to dispute who is doing what and what not, because also technically we also belonging from the same field. So the very first thing I feel like the receiver, like the people who are receiving the treatment or receiving the therapy or the receiving the services, they should be the first people who should actually look for the qualifications. And whether whatever is the disorder, whatever is the problem, whether the person who is providing the services are qualified there for that also. So these are the first thing. If the service takers start doing, eventually, in the last episode also we had spoken about it, things will become very much clarified and it will be properly going.
Yeah. Yeah.
Yes. So yeah, Dimple, what is your take on this?
Yes, I also feel that a nomenclature is very much important, specifically when it comes to dealing with mental health, which was very stigmatized, and again, which is very sensitive topic, which people don't want to talk about. Okay. So when we talk that there are so many healers, okay, faith healers, before we were competing with faith healers, and now we have so many social media pages, they are talking about mental health, and people are self-diagnosing themselves due to this thing more. Okay, yes, Google is giving so many information, there are all the texts available on Google. However, due to this so much overwhelming information which is available on social media, it is making people more difficult to go to a proper setup where the services would be provided. And again, lastly, what is happening, it is hampering their mental health more, it is putting them at more risk, okay, by all this information or misinformation which is available on the media.
Yeah, you all are right. So what are these nomenclatures? So who's a psychologist, who's a clinical psychologist, who's a neuropsychologist? What are these nomenclatures? How do we make people aware of the fact that so and so person has these credentials and they are such and such professionals? What can you give us a general understanding of what nomenclatures fit to what educational background?
Okay, so can I go first?
Yes, please.
Yeah. So a psychologist, if you see in India, what I'm talking about in Indian
Yeah.
scenario, a psychologist is the person who has a bachelor's degree in psychology and a master's degree in psychology. The person is a psychologist, and they can also be termed themselves as a sports psychologist or maybe a counseling psychologist, etc. Now, clinical psychologist is a much more specialized division under psychology, which focus majorly on the field of mental health and wellness and dealing with disorders and disabilities. So to be a clinical psychologist, a person has to go for a further degree that is MPhil in clinical psychology, And I think the nomenclature is changing. So few new changes are coming
Yeah.
to incorporate clinical psychology in the new education policy.
Hmm.
So this thing is on in the pipeline. But till now, the system was to go for an MPhil in clinical psychology. There's a 2-year degree course.
Hmm.
Then you have to get the license, and eventually you start practicing as a clinical psychologist.
Hmm.
Now, again, a neuropsychologist in India, there is no specialized degree to be a neuropsychologist. A clinical psychologist, eventually, who has specialized, much more specialized degree and has a detailed experience in working with the people from the neuropsychological disorder and the developmental area,
Yeah.
the extensive experience. So they can be the person who are the neuropsychologist. So
Hmm.
neuropsychologist majorly focusing on the neurology,
Hmm.
neurodevelopmental and the related areas.
Correct.
So I think these are my takes. So my team members, what are your views?
So, Debalina, if I may add, you mentioned that a person who has completed a bachelor's and then a master's. So, again,
Yes.
putting it on record that what we are talking is just based on the current regulations. We are very aware that new regulations are in the pipeline, and some transformations are to happen. But based on the current regulations, this is the scene that somebody who has done a bachelor's and a master's in a full-time program is qualified to be a is a psychologist. Um, can a person who has done masters in clinical psychology be called as a clinical psychologist? This is a general misunderstanding as far as I know, that a lot of people who have completed their masters in clinical psychology end up calling themselves as clinical psychologists and do happen to get jobs in clinical
I
psychology.
know. I think RCI has already put out a circular mentioning specifically regarding
Yeah.
that you can be a psychologist, but if you're holding the title of a clinical psychologist, then you have to go through the mandatory education qualification to be called as a clinical psychologist. And to be a clinical psychologist, MPhil in clinical psychology till now is a mandatory degree.
Absolutely.
So now depending on the universities, many universities that tend to provide, like, for example, masters in clinical psychology, masters in applied psychology, and so and so. So a specialization in masters is only a specialization during that last 1 year of their degree, but
Correct.
not a specialization in the whole, like, kind of a subdomain in whole umbrella term of psychology.
Yes, yes. You put it very, very correctly. Lipika Dimple, would you like to elaborate on that a little bit, please?
Yeah, just like Devlina has said that after you do a MA, whatever you call it, MA, MSc, whatever the nomenclature is, they're all the same basically. The premise is that you need to have a master's in psychology or clinical or whatever, but there has to be a master's in place. After that, you become a psychologist. Now, if you want to, let's say, become a school counselor, or maybe specialize in school kids, or maybe a adolescent counselor, for example, then you can do other certificate courses that are there. Some are approved by RCI also. Certain counseling courses are approved by RCI. You can do those, and then you can become a more specialized counseling psychologist. But you have to have a master's in place. That is the minimum qualification that you need. After that, you can do other additional degrees, diplomas, and so on, and then you can enrich yourself more with whatever experience you want to have. Having said that, there are other degrees that you can do. For example, after masters, you can do a PhD. That again, you will be called as a psychologist only. Somebody can do a PhD in clinical psychology, but they will still be called as psychologist and not clinical psychologist, because only somebody with MPhil in clinical psychology currently is called as a clinical psychologist. So that is another misconception that is there. And a lot of professionals, even doctors and psychiatrists and a lot of general public, feel that if somebody has a PhD in clinical psychology, let's call them as clinical psychologist, or if somebody has a PhD in normal psychology, let's call them as clinical psychologist. That is not the case. That is not the guideline. The guideline is that you must have a MPhil in clinical psychology to be called as a clinical psychologist. That is the bottom line. Like Debolina said, that if, let's say, you want to be a neuropsychologist, for example, you do a MPhil, then you can do additional courses or you can gather additional expertise, and then you can call yourself as a neuropsychologist. But these minimum criteria have to be in place. Without these minimum criteria, you are not qualified to deal with mental health issues. So that is the, I think that is the ground level reality that is present, that all of us must be aware about.
Yeah.
Dimple, what do you think about this?
Yes, as you have also added, Lipika, that PhD, if people are getting PhD, can they call themselves having a clinical psychologist as a specialization? So similar thing, maybe if done in a US or UK, many people come from there also, and they want to practice here in India. Okay, so same applies there also. However, there are different courses. There are courses like PsyD. There are courses like you do diploma. There is I don't remember the terminology which they are using, but D clinical psy or something, some different terminology they are using. So one thing, when you are choosing any form of a course that you need to be aware of, is it practice-based course or is it only theoretical course? There you can define the difference. Okay. So after masters, if you really are interested to practice as a clinical psychologist, maybe you can apply in a course, even if you're going to abroad, which is practice-based. Okay. And why a practice-based? Because overall MPhil, which we have right now in India, it is a robust course which is both practice and scientific based. Our field is also scientific in a nature. So we practice based on the scientific principle of psychology that you have studied in a bachelor's and master's. For doing all the theoretical things that you have done till master's, and after that MPhil, you are practicing based on the knowledge that you have gained. Okay. So that is a 2 years full procedure. Similarly, if you go to US, you do a whole course of 4 years where you will be after masters, and then you will be going ahead and getting your PhD and you can practice there. And after that degree also, which you get in abroad or anywhere, you have to practice for a certain period and then you will be given a license after giving the examination. So it is a robust procedure everywhere, not only in India, but everywhere outside when we talk about clinical psychology, because we deal with patients with mental health disorders or client with mental health disorders. We are not dealing with the say general population. So that is a differentiation that one needs to understand when you talk about clinical psychology.
Yeah, thanks
Can
for
I add
sharing
a
that.
point?
Yes, please, Debalina.
So I have seen in many cases the question comes, okay, so are the CPs, the clinical psychologists are only allowed to use therapies like CBT, DBT, etc., etc. Now the therapies I would like to elaborate. Suppose CBT is there for depression and CBT is there for many other disorders also, and also non-disorder cases. So a person normally in MPhil we get trained in various form of therapies that really helps us to apply them in the practical field. Now, sometimes in masters, the theoretical outline is so detailed that people don't get that much of exposure into developing some sort of expertise in therapies. So, if, yes, after masters, the person can be called as a counseling psychologist. And if they can go and get their certification done from proper places, for example, they can do it, for example, Beck Institute, etc. Like Beck Institute providing the certification course for CBT. So they can learn therapy and apply to the non-clinical population.
Correct.
So therapy can be applied by many people depending on which population they are applying.
Yeah. That was a very important information, Debalina. Thanks for sharing that. But to slightly, move away from the topic, Lipika mentioned a very important point as to both BA, MA, MA and MSc being the same thing. Dimple, I would like to pose the question to you because you're currently in academia. Do you think there is a very big difference between MA in psychology and MSc in psychology, because a lot of students find it very difficult to choose between the two? So if you, from a first person's perspective, can elaborate on whether or not there is a difference, it would be very helpful.
So I will also include all of your viewpoint because we all were in this academics together and there we were teaching MSc. Currently, I am teaching MA. Okay, and I have studied MA. So overall the perspective that I see, the institute are choosing the course and curriculum according to the according to the theories which are being taught, such as let's say personality theories that you are learning in masters. Okay, or you are you would have learned neurobiology or you would have learned biological psychology in bachelor's. That same paper would be extended more in a master's, would be much more theoretized in the master's. So if I see the differentiation, there is not much. Okay, yes, the number of papers may differ. That could be one of the things, that you are choosing more number of paper, specifically if we talk about MSc than MA. But it is upon children's also. If you can, in a foundation or in other electives and everything, if you choose psychology, paper more, it would be helpful for you as you go ahead. So as such, I don't see there is much difference when we talk about MSc, MA. It is about just a nomenclature which is different.
Yeah.
At the
Thanks
end,
for
you are
sharing.
becoming psychologist.
Yeah. Makes a lot of sense. Lipika, Debelina, would you like to add something to this point?
Yeah, I completely agree with what Dimple has said. There's not much difference. It's just the nomenclature, like
Yeah.
she has mentioned. Also, it's better if the students they have a look at the syllabus, like whichever university you're applying to. Let's say if you're getting accepted at more than one university and you're confused which one you want to go to, always better to have a look at the syllabus so that you know what subjects you will be taught and what subjects you will be learning. So, for example, in some universities, you might have a specialized subject of only one nature, for example, only psychodynamic nature. There will be more specialized subjects about that. In another university, you might have more general subjects like peace psychology, cross-cultural, and criminal psychology, those kind of things. So, have a look at the syllabus, decide what is it that you want to pursue further, what interests you more, and then accordingly, you can go for it. So, it doesn't really matter if you have a MSc or a MA, weightage is same. So it's not like you will be preferred more if you have a MSc or you'll be preferred less if you have a MA. That's not the case. Even if you want to pursue further studies like PhD or MPhil, both nomenclatures have same weightage. MSc, MA, both are the same thing.
Yeah.
So it's not like there is stark difference or anything. So always better to just look at the syllabus and then go ahead and see what interests you. That is what I feel in my opinion.
Okay. So even I agree with both Dimple and Lipika regarding, and in my personal experience, I think based on the university to university, they choose the nomenclature. So there is no much difference. I think students can make it a basic, this thing very clear. No matter you're doing MA in psychology or MSc in psychology, the outcome is going to be the same.
Yeah.
So
Because
only maybe
paper
the few
are
course
all,
structure, all are same, majorly are same, and few electives might be different,
Yeah.
but majority it is same.
Yeah. And
papers
there is
are
no
same in all the university. If I see, even from my university and from past two university that I'm teaching, papers are generally same. How, yes, with time, let's say in our time, positive psychology was not taught as a paper. Okay, maybe that could be a elective. That was not compulsory paper. But as we move ahead and as the new things are developing, new researches are coming, that difference will be seen in the education or in the theoretical aspect. New things would be added, new electives would be added, or more number of papers would be there. Then children have a more choice to decide which paper they can choose. That is a small difference that I've seen till from past 10 years from my studies and everything.
great. I'm
To
glad
add
that
more onto this, Shrita, can I
no
add a
worries,
point?
please.
I think this battle between MA and MSc in psychology, I think it has started because there are a sector of people who think psychology comes under humanity. And there are certain people who think it comes under social sciences. So because in psychology, we do end up having multiple researches and where we actually collect evidences. So whenever a research is quantitative and qualitative research is being involved, so automatically people think it falls under the category of science.
Yeah.
So it is a social science. So I think universities was going more with the social science perspective. They tend to have more of a MSc. And universities who is holding that understanding, it comes majorly falls under humanity. So they tend to put more focus on MA psychology.
Yeah. Actually, Debelina, to elaborate on your point itself, I feel like as a psychology fraternity, over the past decades, we have been fighting so hard to make it look like concrete science that now a lot of people are actually defeating the purpose by, bringing in faith and bringing in religion and bringing in perhaps manifestation and everything. I think it's very important to put it out there that our personal beliefs about what law of attraction is and manifestation is does not really matter when it comes to practicing psychology. Perhaps me on a personal level, I may believe in manifestation, but I have to make sure that I put out objective work when I'm in practice. Would you like
Correct.
to elaborate a little bit about that? Because there's a
Yeah.
very thin line, on Instagram also, there are a lot of people that, talk about mental health and plus use these dynamics. So what do you think about that?
So I think even if a person is using manifestation, law of attraction, whatever, so I am not here to deny whether these things exist or not. But if you really want to incorporate this to the existing psychology, so then it is always good if there is some concrete research is there on this
Yeah.
area.
Yeah.
So it can be evidence based, then definitely it can be added if it is relevant to the field. So if it's not evidence, and a psychologist, if or anyone who is thinking this might help the patient, sometimes even the client have different thought orientation.
Yeah.
So they should mention that whatever they're suggesting is not directly from field of psychology, but from some alternative field of healing and the other strategies.
Yeah.
So this clear explanation should be there.
Yeah. Yeah. Lipika, would you like to give us a few
Yeah,
examples of these?
yes, yes. You guys have clear, correctly mentioned that a lot of like mental health practitioners on Instagram, they will say that a psychologist and a tarot card reader, for example, or astrologer and psychologist or something like that. So astrology is different, right? Tarot card reading is different. Healing practices are different. All of these are different fields. They are not psychology. So if you're calling yourself a psychologist, you must have a main psychology like we are discussing. And you might have done some additional degrees in tarot card reading or astrology or whatever. And then you might say, I'm also an astrologer. But they're both not connected. So if you're doing therapy, therapy will not involve tarot card reading, because in therapy, we use evidence-based practices like Debelina has mentioned. Now, what is evidence-based? Evidence-based is basically the therapies that we are using. We are not making them up on our own. They are already there. These techniques are there. They have been well researched since many, many years. A lot of RCTs are done. A lot of papers are published. Everything is there. Like there's a structure. We just follow the structure. We don't say things out of our own will. We don't say things because we believe in them. So there is a set structure that we have to follow. Like we just don't randomly say things. So that is basically what evidence-based therapy is. So if you're a psychologist, you must go ahead with only evidence-based therapies and not what you think might appeal to the other person. So you must always differentiate these practices to the client, because the client will not always be aware. So you must say that, okay, I am a psychologist. As a psychologist, I can practice so-and-so therapy. But if you want some other services from me, let's say tarot card reading, I can do that. But that is not psychology. So that awareness must be present, that these are additional, like complementary alternative medicines are there, like Debelina said. They are there in place, but they are not psychology. So it's better people don't relate them to psychology. And that is something which general public needs to know.
I'll add an example to this. So recently what happened, one of my family member would have went to, let's say, temple. Okay. They were asking about that when things will go better and everything. So they were telling, okay, whatever you are going through, it is fine. Okay, you do puja, you do all the, like say, all the practices that we do in religious activities. However, if you have this another set of symptoms, you can go to hospital and get the proper treatment. Okay. Yes, this will work. Your puja and all this thing will work. However, with that, you need additional, say, supplements, additional therapy or anything for the symptoms that you are going through. So nowadays, if we talk about, yes, faith healers were always present and will be present for another set of years, and they will not go from our society till at least another 100 years. So it would be part of our society. But however, they are getting aware, and how he got aware, because his own wife was suffering from depression. So let's say if your family member are suffering from something, then you understand, okay, this is important. So the awareness is coming up after COVID-19. I say awareness has spreaded a lot, and they are also referring people. But how much we are here to accept, and what is this thin line that what should you do and what should you not do? Let's say that faith healer knew that Pujari knew that this is not my work, and I referred it. So that referral is very important when it comes to like what is your cup of tea, or what you can practice, what you know, that you have all this practical knowledge that you have learned it through, let's say, training, and what you can refer. So that is the best way we can like go about when we talk about mental health.
Yeah, I completely agree. And social media is the best outlet to make this awareness reach people, isn't it? But unfortunately, there are so many misleading information out there. There's so many people trying to put in their perspectives, and because of their large number of following, and because of excellent marketing strategies and a very nice social media team that they have, that they do end up reaching masses. So, do we think that the authenticity of a mental health practitioner is defined by how many social media followers they have, or what kind of social media footing there is? What are your thoughts on that? Just curious.
Quite debatable, I will say, quite debatable. Because again, an expertise and number of followers doesn't match.
Yeah.
So number of followers do indicate that they're quite popular.
Yeah.
And maybe the content they're giving is liked by the masses.
Yeah.
So they're relevant to the masses. So they're understanding. That is okay.
Mm.
But when it comes to the individual level of treating a person and very individual level, so that can differ and might not differ also. So again, coming to the point, so the number of followers and the quality might not be always the same. They are not actually conclusive of each other. They're different from each other.
Correct.
But there are wonderful people out there who have good number of followers and they're doing a very good job to the society. So I would like to say something: with greater power comes the greater responsibility. So if you have a huge number of followers, you have to take up that ethical responsibility. Sometimes ethical responsibilities are not great because you have to cut down on many things.
Yeah.
It's good that if a person can take up and give the authentic information to the masses. Because otherwise, in general, if the mass is getting the correct information, it is good for the society, and eventually the society will be well balanced.
Yeah.
I think that's all the take from my side. Yes. Simple and Lipika.
I feel that I don't think there is, in my personal opinion, I don't think there is any correlation between the number of followers you have and how good a therapist or a mental health practitioner you are. Because I know a lot of good therapists who are not on social media. Like they have no social media footing and they are like really good. Like these people are really good. So it's not necessary that people who are there on social media and who have good followers will be good therapists or vice versa. Because like what Debelina said, if you have good number of followers, then yes, people resonate with you and they find your content good and those kind of things. So the line here is that they find your content good, okay? But if you want to be a good psychologist or a clinical psychologist or a good mental health practitioner, you need to have a certain skill set and a certain type of personality. Now, when I say certain type of personality, this is something that there are certain traits that you can't really teach yourself, or there are certain traits that you really can't develop. Like you really need to have them with you. Like you need to have a certain temperament. Now, if you're not born with that temperament, unfortunately, you cannot be a good psychologist. But at this point, I remember when I just joined my bachelor's in psychology, and this is something which I tell all my students, all people who I interact with, because this line resonated with me a lot. And my HOD at that time, she told us the first day in class, all of us are just new. It's the first time, the first period we're having, and this is hers is the first face we see, and she just tells us, the first thing she tells us is, if you want to be a good psychologist, you have to be a good human. That's the bottom line. So that is the bottom line. So if you're not a good human, no matter how many degrees you do, what blah blahs, PhDs, whatever you do, you can never be a good therapist.
Yeah.
So there are certain skills that you need to have. If you don't have that skills, you will never be a good therapist, no matter how many followers you have or what you're there on social media, not on social media, it doesn't matter. So I think that's the bottom line. And if the general audience does want to connect to mental health practitioners, it's important that they verify everything, not just by their followers, but they verify everything, their qualifications, their expertise. If they really want, they can actually ask them that, okay, can you show us your degree? I don't think there's anything wrong in that. Because even when we visit doctors, right, a lot of them have their degrees on their wall, or a lot of them have it on the display. So we know that, okay, this degree is authentic and they have gone to this and this place. So there's nothing wrong in asking your doctor that, okay, if you don't mind, can you tell us where you've been to, what's your degree, and those kind of things. So it is the responsibility of the audience also to verify these things and then go ahead with the person they want to go ahead with.
Very true. You wonderfully concluded it, Lipika. I think we've covered quite a few topics and quite a few very important information that is out there. And one of the more important things that we did cover today was the fact that Instagram is a platform for entertainment and not primarily designed to educate. So if we use that, we must use it conscientiously. And secondly, the fact that, certain nomenclatures come only upon a certain degree. How about we try to elaborate a little bit on that in the upcoming episode? We talk a little bit about, MPhil, because we've collectively done MPhil. So we are at a better position to talk about why MPhil is a degree that warrants a clinical psychology designation. So how about we do that?
That's a good idea.
Yes, yes,
Yeah,
yes,
sounds
let's-
good.
Really good idea.
Yeah.
Quite interesting one.
Yeah.
Yeah.
All right. It was a very interesting topic. Thank you so much, Dimple, Debulina, and Lipika for sharing your thoughts on mental health. I think a lot of people will really benefit from this kind of topic, and we'll have more such discussions and deliberations in the future.
Sure, sure.
So up
Thank you
until
so
then,
much.
Thank you, Shrita.
up until then, please to our audience, do follow us, do subscribe to our channel, and we'll keep coming up with more and more such videos. Thank you so much.
Thank you. Thank you
Bye
so
bye.
much.
Thank you.
Bye.
Bye. Thank you.